Good afternoon, everyone. Welcome to Medical Grand Rounds. Before we begin, I would like to make a brief land acknowledgement. McGill University is on land which has long served as a site of meeting and exchange amongst Indigenous peoples. We acknowledge and thank the diverse Indigenous peoples whose presence marks this territory on which we now gather. I'd like to remind everyone to please leave your questions till the end. Please enter them in the chat. And please fill out a brief survey that will be sent to you immediately after the presentation. This will let us know that you were present today. Finally, it is a great privilege to introduce our guest speaker today, known to many of you, Dr. Nitika Pai, who is one of ours, an MD PhD here at the MUHC and McGill. She's a tenured professor in the Department of Medicine at McGill University and a senior scientist at MUHC RI. She runs the Smart Unlearning labs at McGill. Her global implementation research project is on connected digital diagnostics for marginalized equity-deserving populations. This is based in Canada, India, and South Africa. She is also working with US-based NIH Portent Center for Diagnosis, which operates in Uganda, Ecuador, and India. Not surprisingly, she's recognized as a global expert on point-of-care diagnostics, digital diagnostics, inflammation science for HIV, STIs, hepatitis C, hepatitis B, HPV, and more broadly, transitioning to sexual reproductive health issues and digital health. She's recognized with prestigious awards, including the SAAP Award from Google, Plos Wellcome Trust in 2013. She's had the Chanchalani McMaster Award for Research Excellence, the Maude Abbott Award for Research Excellence, and several, or many, I should say, other awards. Finally, she serves on the editorial board, is the section editor for 6 biomedical journals, is a grant reviewer for global national health agencies. And honestly, I could go on and on. I think so far what I've said says it all. We are very fortunate to have her here at McGill. She's given many presentations internationally. She's internationally recognized, and I'm looking forward to hearing what you have to say to us today. Thanks for being here.
Thank you, Nadia, for introducing me. Hello, everyone. Good morning. So today I'm going to talk about Diagnostics 4.0 as it relates to HIV STIs, the now and the envisioned future. Oh, it's not moving. Sorry. It's okay. It's technology. It glitches. So my work has been on point-of-care diagnostics and technologies, and it's expanded to digital health and ML integrated solutions. The learning objectives of today's talks are, I'll orient you to One Health, digital health, and these concepts of, healthcare 4.0, diagnostics 4.0, and share with you insights on guidance and frameworks that have been in evolution, aligned with the One Health mission of WHO. I'll also showcase these diagnostic innovations, digital and AI solutions that are poised to transform the future. But the focus is more on HIV STIs because I work in that space. And then I'll address some of these ethical, legal, and security concerns that we all have in deploying these solutions. And lastly, I'll conclude with a call to training of healthcare workers and healthcare professionals and a call to embrace change. Bear with me. So in 2020, and this has been going around for a while, but in 2020, there was this great realization in diagnostics. I call it the diagnostics consciousness, because we realized that diagnostics is really essential to knowing one's first serostatus, and knowledge of infection is the first step towards getting into the healthcare system. And thankfully, that diagnostics consciousness was also happening in one of the world's leading agencies, and they came up with this concept of One Health. This concept of One Health has actually existed in cultures, before us. And this concept of One Health is very interesting because it unites healthy ecosystems, healthy animals. It unites environment, human, and animal ecosystems. These are called sectors and disciplines. And then the environment in which they live that defines the health ecosystems and also helps with healthy humans. And then the coordination that is needed for our society to function so that we can also enable all of these developments for inclusivity, equity, and access. But for all of this to function as one health, which is integration of animal and human health ecosystems, we need collaboration, communication, coordination, and capacity building. And that being said, this concept further extends to beyond this to citizens' engagement, education, environment, human and veterinary healthcare, and also talks about healthcare industry 4.0. Now, basically, healthcare industry 4.0, and I've described it in the next slide, it is talking about use of internet and digital and machine learning integrated solutions to advance the cause of health. Now, as you can see that this concept is very fascinating. It's also called the One Digital Health concept, but there is also this connection called the technology ring, where technology and diagnostics that remain really essential to healthcare are being emphasized. As you know, diagnostics is needed to monitor, to screen, to detect all the problems in all of these domains. And thankfully, digital health has emerged as a key component in politics also. So as part of G20, it was discussed. And then in 2020, Global Health Strategy on Digital Health was launched by the WHO. I have a URL for this, which is, I have a screenshot here so that you can visit and you can find, this is the URL here. You can go to all these topics that are being covered by digital health and by WHO. Now, when I talk about digital health, what am I talking about? So in the past, 15 years ago, when some of us were working in this space, 15 to 20 years ago, we called it telemedicine, telehealth. And now the field has expanded almost. And so we're talking about the very broad scope of digital health covers mobile health, telemedicine, personalized medicine, AI-enabled diagnostic devices, medical product services that have software as a medical device in them, machine learning-based algorithms, bots, drugs and biologics to companion diagnostics. So this is not stopping. There is metaverse and there is other solutions also that are coming in. And of course, the large language models. So basically, what are we talking about? Technologies, all of these computing platforms that have sensors and connectivity built in, they are supposed to drive healthcare 4.0. The idea behind all of this is to harness the power of digitization. Of course, you need several other variables for digitization to work, and that's what we're going to talk about later. But what has happened in parallel is that the FDA is also trying to figure out, and trying to keep pace with all of these developments. Especially 2 years ago, we had, large language models, generative AI was released, and the FDA is still trying to figure out. As of December, they released a note that they're trying to figure out how to use and deploy these models equitably. If you're interested in knowing more, I have a reference here so that you can check on all these regulations. So to summarize, healthcare 4.0, this is where we are getting into basically smart connected patient systems, patient-centered healthcare systems that can complement the traditional systems. And the idea behind it is to leapfrog care and to make it more patient-centered, and also to drive the conversations and the services towards preventative care. And in the process, digitally transform the health ecosystems. Now, in alliance with Healthcare 4.0, we talk about Diagnostics 4.0, and that is diagnostic systems that are enabled by AI and digital devices. And again, the idea is to provide patient-centered care. So in 2020 and around 2021, 2022, WHO's Global Health Strategy was taken further, and it was presented at the World Health Assembly. And this was the 73rd World Health Assembly. This was the first time diagnostics was actually discussed at the World Health Assembly. And why is that important? Because diagnostics as a domain, as a specialty, has always been in the background. So it really came to the forefront. And that's why I call it the diagnostics consciousness that has happened over the years. So the strategy really talked about institutionalization of digital health within most of the national healthcare services, called for an increased adoption of digital health strategies, called for an integrated strategy that has to be put in place with strong governance and appropriate use of technologies and digital technologies. This is an entire folder. If you want to look at it, please Google that. And the idea is to also address all these impediments that may arise and that will arise in the global adoption of these technologies. So the most important thing with these digital health strategies is that they have to be equitable, they have to be safe and smart, they have to be secure, reliable and sustainable, and they have to be implemented with principles of transparency, accessibility, scalability, replicability, interoperability, privacy, security, and confidentiality. Each of these words are like worthy of pages of guidelines and recommendations, but that's the big framework of the strategy. Now, these themes have emerged in diagnostics post-2020, and my focus is all going to be HIV STIs, but I think these themes are now percolating in other spaces also. So the first theme that has emerged is home-based diagnostics. So there is an increased shift towards home-based care, and along these lines, self-testing, self-sampling has become really popular. There's a lot of data in support of self-testing solutions. Then the second theme that has emerged is integrated diagnostics. So multiplex solutions, which is diagnosing multiple infections with a single sample of blood, serum or plasma. Those solutions have also become very popular. And now increasingly so as we move towards 2025, 2030, there is an increased integration of machine learning and AI solutions within multiplexing, which makes them extremely powerful in detecting multiple infections in one patient visit. Diagnostics for precision public health. Machine learning Bayesian models are doing a better job of predicting. NGS has come about for surveillance, has been very much accepted post-2020. And then precision diagnostics for precision medicine with the use of omics and CRISPR technologies has also emerged. So these are the themes that have emerged. The technologies that are poised to reshape delivery, service delivery for HIV STIs across all global settings, in line with the themes, are multimodal. So a few years ago, apps and platforms were good, but now they're not good enough. You have to add dashboards, you have to add chatbots, you could add Internet of Things, you could add wearable devices. So all of this is kind of comes under one umbrella, which is called multimodal technologies. The second is multiplex technologies. Like I said, multiplexed is a theme, so those technologies are in evolution. And I'm basically going to focus on talking about these technologies. Omics, which is nanotechnologies and precision that are guiding precision medicine and CRISPR. Then you have machine learning solutions that are used for risk staging, and quantum diagnostics, which is coming because quantum technologies are evolving, and they are going to also help transform efficiency and accuracy. So I was a big fan of Star Trek. Growing up in India, we used to watch Star Trek every week. And I feel that given all of this, given the evolution of themes and technologies, the day is not far away when we'll have a tricorder that Dr. Scott used to use. And the spectrum of use and the use cases have also evolved in tandem with, the spectrum of technologies. So is tricorder really far away? Probably not. Allow me to make that case. So a few years ago, my fellow co-led this work with me, and we talked about and we discussed the modern diagnostic technologies for HIV. And we found that over the past 40 years, HIV has made huge strides. And HIV is one of those infections that really sort of sets the standard and leads the way in infectious diseases. So we started out with ELISAs, we moved to Western blot, then we moved to HIV RNA tests. We started out with rapid antibody-based tests, and we moved to antigen antibody-based tests, the combination tests. Then we came to self-tests somewhere around 2012. ELISAs and Western blots happened in the 1980s, 86. Rapid tests around 86, 1990. Self-tests around 2000. And this evolved to multiplex self-tests around 2014, 15. And now multiplex biomarker-based tests are becoming very popular, and they become really popular with healthcare workers. And that's around 2020. Microfluidics and nanotechnologies have been around for a while, but their uptake and scale has not been that great. But now we're talking about CRISPR solutions, which are miniaturized, and that's like the now. And of course, we know that there is a proliferation of digital and machine learning solutions. So even though we talk about technologies, we think that the concept of context of use of point of care diagnostics has also evolved. And it became really popular or sort of was better understood during COVID, because people realized that it's not just enough to have technologies. It's also important to use them in the right way, in the most sensitive manner, in the right context. And a lot of factors come into play when you're trying to detect infections with these technologies. And the same technology can be used in several different spaces. It's almost like there are many avataric manifestations of these technologies. You can use one technology, especially with rapid point of care tests. You can use them in homes where they become self-tests. You can use them in the professional care settings where they are called professional use tests. And you can use them anywhere in between. You can also use them in outreach settings. Then you can use advanced forms of these technologies. Actually, a big user of rapid point of care technologies are labs, tertiary care labs. So basically, the use case and TPP, the target product profile of these tests, can move from home to communities, to outpatient setting, to peripheral lab, and to hospitals. So that makes them really portable and convenient and impactful. So, like I said, the connected mobile technologies have sort of now taken this field, and in 2025, it's almost as if any of those point of care technologies do not come with machine learning solutions, or they are not integrated or connected, the results from those tests are not going to be of any use, because tests are only useful unless they are acted upon, right? So these connected multimodal solutions for diagnostics can be effective at the user level and the health systems level. At the patient level, they can address all these pain points that we have in access to care, in linkages to care, in providing personalized care. At the health systems level, you can actually identify poorly performing sites. You can use them as use cases and plant them to be able to pick up these poorly performing sites. You can also introduce efficient workflows in clinics and health systems and reduce inefficiencies. So this is possible only when you have these technologies integrated with machine learning solutions. You can use and detect poorly performing sites, because this diagnostic data that is being captured in the back end gets reported back to tertiary labs. And that's how you can keep an eye on all the errors that are happening at the systems level, and also the errors that are happening in outreach settings. And there is a way to make these technologies and to make the systems efficient and introduce quality and cost systems and improvements at the systems level. Now, for home-based diagnostics, I think digital HIV self-testing is the new HIV self-testing paradigm. Because now the story in self-testing, which started out in 2012, has moved towards use of digital supports, apps, platforms. And there is enough and more data of linkage to care. And these technologies are really helpful, because tests alone, or the knowledge of a test alone, is not going to help patients seek linkage to a care provider. So digital technologies can step in to fill that gap in service delivery. And linkages to care have increased, or have been documented to be 50% to 65% without technology, and they've increased to 99 to 100%. And this data is accurate across the board, across Asia, across Africa, across North America. With technology, there is an increased engagement of end users. So that proactivity, that allows for proactivity in healthcare seeking. And then with technology, you can also intelligently plan task shifting of healthcare workers. Like you can shift some of the pre-test counseling, to technology, and save the task for post-test counseling and linkages to care. So overall, the evidence has increased in favor of digital supports. And the thing that we need to watch out for is scaling up of these digital platforms and solutions with public-private partnership, integrating them within healthcare systems. For that, the data currently are limited, and that requires governance and implementation of national digital health strategies. That is happening in some African countries and really efficiently in Asian countries. So, that can really make a big difference. Now on to multiplex integrated testing. Like I said before, multiplex is basically detection of multiple analytes. These analytes could be anything. They could be biomarkers, it could be nucleic acid tests. Platform technologies like the ones that detect RNA or DNA, molecular level technologies, they are incredibly useful in giving a rapid turnaround to test results within a matter of 1 hour to 2 hours in an outreach settings. And there are lots of technologies like that. And Cepheid is one of those technologies or platforms that has become very popular, but there are lots of other products also out there. And how are these platforms or multiplex tests useful? Because sometimes patients, when they come to us in healthcare settings, they sometimes have comorbidities, and you would like to screen them for comorbidities. And if you don't offer that test, they have to come back again at another time and waste their time and yours. So at one point in time, you can screen them for multiple comorbidities and also run multiple profiles on them. And that's how you can actually get the economies of scale and, cost savings in the healthcare system. And these platforms are actually really good for disease elimination programs, because up until now, HIV program was a vertical program, syphilis program was a vertical program, TB program was a vertical program in international settings. But these programs can all be combined with the introduction of technology. And they're very useful for antimicrobial stewardship. So that is a powerful bonus, because that's something that we have always ignored. We've always prescribed, but not really tested to find out whether these prescriptions and these medicines are actually being taken, and they are not just leading to drug-resistant strains of bacteria and viruses. But the challenge with these multiplex integrated platforms is that the cost per unit cost of cartridge is still high. So it's very hard to procure a lot of these cartridges. Sometimes a clinical healthcare setting has to sort of adapt their workflows to the technology, because, it sort of challenges the system. And if those adaptations are not discussed, sometimes the flow of patients through the healthcare clinic or outreach setting needs to be discussed. And if that is, so it calls for infrastructure requirements also. And if that is not in place, or those are not in place, sometimes you don't get the right, benefit. But a systematic review, this was also done in our lab, and we found that, the specificity and sensitivity of these molecular platforms is like off the charts. It's more than 100%. And some of these immunochromatic graphic tests that, I've evaluated them for a very long time, they've also improved a lot. And these can detect, like some of them can detect 4 STIs, some of them can detect panels. But the diagnostic performance varies by the pathogens you are screening, the populations you are screening, the level of endemicity of the pathogens in the population, like what is the seropositivity before you're testing them. And then the level of impact determines on the type of technology and the reference standard you have. Okay, so now on to nano and CRISPR. So nanofluidics and microfluidics have been around for a long time. These are basically, microfluidics is something that you can do at micro scale. Nanofluidics is something you can do at an even finer scale. And there are experts at McGill who develop these technologies. I'm only going to talk about the usage of these technologies. The platforms for many of these microfluidics and nanofluidics are available, and they are becoming even more sophisticated. And with economies of scale, hopefully, they will become cost effective. So with microfluidics, you can take the chips and you can detect antigens and antibodies. You can do flow cytometry. You can run these immunoassays. You can use them to monitor disease progression. And with nanofluidics, you can improve the sensitivity of these with smaller volumes. They're very useful for DNA sequencing, very useful for epigenetic studies, and for drug delivery and toxicity analysis. Now, in line with these developments, we have CRISPR. Now, as we know, Jennifer Doudna, a few years ago from Berkeley, won the Nobel Prize for CRISPR. CRISPR is basically family of DNA sequences that are found. So family of DNA sequences are found in the genomes, and CRISPR-Cas gene tool uses the sequence of DNA to edit these base pairs. And this is actually offering a lot of potential to develop HIV treatment and cure solutions. And there are CRISPR Cas gene editing tool-based tests for HIV and for STI that are in development in many labs of the world, and those are the leading labs. So the next generation diagnostics I predict is going to be with CRISPR-Cas, because it can help you detect these point mutations and deletions, and this will be very useful for not just POC use, point of care use, but also home use, but also clinic use. The challenge with that will be protocols and instrumentation, and I don't think we are ready for them yet, so we need to evaluate them. The fourth technology is next generation sequencing. So those of us in the field, we know that sequencing took us by storm during COVID. It did really well because they could identify clusters with sequences and detect outbreaks really rapidly. They can detect the low abundance drug-resistant variants. So this is extremely useful for AMR and for monitoring. The thing with next generation sequencing, so they can help you study viral evolution, they can help with drug resistance, they can help you study dynamics, they can help you monitor patients on treatment. The thing with this, the thing to understand, the challenges with next generation is interpretation challenges and costs. So you need to invest. It's like investing in a house. You've got to invest in those technologies for them to be able to yield those profits in the long term. So the next technology after that is precision diagnostics. And these are a whole range of diagnostics technologies that are being evaluated in our own institution by different investigators. And they are going to be extremely relevant and are relevant for precision medicine. So genomics, as we all know, is the branch of molecular biology that studies genetic patterns of genomes, microbial genomes. Metabolomics, which I think is even more interesting because it studies the response, it studies the metabolites and analyzes them. Metagenomics, I find, is an extremely important field because it sort of studies these nucleotide sequences and tries to understand the interrelationship of these sequences and these omics with the environment. So it's a little bigger than just studying, the impact of studying these sequences. And multi-omics-based analysis are being used by some centers in the US to really look at the profiles, metabolic profiles of individuals who are or are not responding to the treatments that have been prescribed. And that is, I think, probably in other spaces, probably in cardiology. Nadia's nodding her head, so I'm hoping that, it's probably being used because cardiology has been very advanced in some of the spaces in diagnostics. The sixth one is machine learning. So how is machine learning going to help us? And machine learning is already, there are lots of publications out there. They talk about detection, prediction, and decision support. So those are the three areas where machine learning is really helping us. It helps you identify the disease biomarkers. And how does that help you? That helps you with validating it and also predicting which diseases are going to be present and how you can act on them early on. It helps with diagnostic decision rules. So then you can have algorithms that can help you advance the disease detection. Protocols that you have in place. It can also help you monitor. Then clinical decision support solutions. A lot of them are coming out. We've got to figure out which one is going to be best for triage, which one is going to be best for treatment, which one is going to be best for monitoring. And then integrating these support solutions within clinical workflows will be a challenge, but also a task. You can monitor site performance in the deployment of diagnostics. I feel that can be taken up by these key agencies like CHI and FIND and all of these other agencies that work in diagnostics to look at which of these sites in ASLM, they can look at which of the sites are not performing really well by deploying machine learning in the background. As in, using algorithms and trying to figure out how many sites have deployed these algorithms to be able to see how many of them are inefficiently deploying it and how many of them are efficiently deploying it. The machine learning solutions are extremely useful for healthcare systems for predicting the population risk. So in the HIV space, some of these algorithms have looked at risk stratification. They're also predicting risk stratification in our lab. We use Bayesian diagnostics, and Oliver has looked at estimating the HIV risk in patients with high risk for HIV testing or PrEP, because in the era of prevention, it's very important to figure out who amongst these patients is going to benefit the most and is going to be adherent. And so these models are really useful in helping predict that HIV risk. Alstom has looked at a nationwide registry of like thousands and thousands of individuals, and have found that these models that are called gradient boosting models, they predict HIV using age, sex, history of STIs, and medical history, just those 4 variables alone. So that's really key because sometimes, we sort of ignore some of these socio-demographic predictors. Muta et al. Has looked at classification models to identify predictors of HIV. They have developed an algorithm called XGBoot algorithms, and that has predicted that age, education, work for pay, and wealth, they help predicting HIV positivity in 92% of the participants. So even though machine learning models are superior, the challenge in deploying these machine learning models is trying to figure out which population have they been predicted in and then whether they can be applied to our population. I think that is the million-dollar question, rather than just deploying them without understanding, how or where the data comes from, because then you're risking a little bit of the bias in there. But for simple things like image recognition, which has almost become very popular in radiology and oncology, in diagnostics, it has also been considered and being integrated, and WHO and FIND have released their policy guidance. They're open to the use of apps and readers, because sometimes these rapid tests do not help you get the test result. Like sometimes you cannot interpret the test results properly. And so ML use of image recognition really bumps up the accuracy and increases it to closer to 99 to 100%. So if you're not happy yet, there's something more that is going to come, and that is going to be quantum. Quantum physics is going to change the game, and there's going to be a lot of quantum computing and quantum dots and bots and diagnostics in the next 3 to 5 years. I predict that the industry is always ahead of us when they try to embrace new solutions. And quantum computing is like the next level of computing from cloud computing and fog computing. It's more efficient. It is very powerful. It is rapid. It is reliable, and it requires the 5G and 6G connectivity. And it actually is based on this qubit technology. And so there are devices in development that are looking at smart chips with the quantum technology. They're going to be ingestible devices. They are already in development. And so the hardware infrastructure has to sort of change to embrace them, and they will become even more powerful. So you will have powerful solutions, and then we'll have to figure out how to deal with their power, because I think the healthcare systems have to work around them to embrace them. But as much as I enjoy technology and enjoy evaluating them, I feel that there is a sobering aspect to technology, and that is the context of use behind it. And so sometimes, as Steve Jobs also said, technology alone is not enough. If you have great seeds, if some of you are maybe into gardening, if you don't prepare the bed, those seeds are not going to germinate. If the bed is not adequately fertilized and prepared and mulched, the best of seeds are not going to flower. So that being said, technology will only be as good as the people who are going to use it. So this is the whole point of technology. And I love this quote by Don DeLillo. He says, it creates an appetite for immortality on the one hand, but it threatens universal extinction on the other. So there is that whole phobia about singularity. And if you were following these conversations on machine learning and AI that happened at Davos last week, they were saying that, they were talking about how the collective human brain intelligence, and these machines are going to surpass the collective human brain, the intelligence of collective human brains by 2045. But they are actually saying that that's not going to be 2045. It may happen even sooner, say in the next 5 years. I would say that that is something that we need to watch out for. But that being said, just the fact that it surpasses human intelligence doesn't mean that the technology is good enough for deployment. And we need to really prepare the beds. We need to prepare our healthcare ecosystem. We need to train our healthcare workers. We need to set up those systems in place so that we can embrace the power of technology. Not just the technological diagnostic solutions, but also the machine learning solutions that bring in them phenomenal power. But my hope is that the science and technology does revolutionize our lives, but memory, tradition, and myth frame our response. And this is where I think I stand. And I hope some of you do too. The part 3 of this talk is basically related to ethical, legal, and security concerns. And all of us have these concerns, and they're all valid concerns. So one of the biggest concern is data privacy. And if you invest in patient confidentiality, so if we invest in HIPAA solutions, which are really expensive, they have multiple firewalls, at least 10 to 20 layers of firewalls. But if we invest in those solutions, then unauthorized access is secure. But again, there is nothing that is 100% secure. But if we invest in encryption, if we invest in blockchain technologies, then we can be we can be sure that we are not harming the patient, and we can be sure that we are securing the data. The other thing that is extremely important for us to understand is how we will respect patient autonomy. Patients are going to be very well informed. They'll have the right to information. We will provide them with their own data Some of them may use the data, some of them may abuse the data, but then that patient education is extremely important as we embrace technology. What about bias and fairness? So it's also extremely important to continue to invest in DEI programs, because there are these tools that are called AI fairness assessment tools that can prevent unfair treatment from happening. And it's important to also understand where the data are coming from, because they cannot be dumbly they cannot be unsmartly applied to different healthcare populations. And as we know, the data from populations that are typically denied access is usually not available. And so predictions from those populations are not available. And so that is something called the algorithmic bias. So we need to be very clear about that. And as far as transparency and accountability is concerned, I think we need to present that information, and we need to make sure that the patient understands what is being done to their data, and that can prevent the breaches of trust. And of course, if we keep this in place and work on all of these areas, then we can work towards equity and make sure that populations that traditionally get excluded do not get excluded. There are two agencies. One is the GDPR that has formulated guidelines, and I have listed it here so you can look it up, and CCPA in California. They have worked on a lot of guidance and privacy laws around data sharing and data breaches. Blockchain technology that I mentioned before is like healthcare technology, where data is secured in a node, and the likelihood of that node being breached is low. So each node is protected, and there are multiple nodes that protect your data. So that way, the developers have ensured that the health data is going to be secure and not going to be transferable nor breached. But we do need stronger data protection laws. We do need stronger IP protection laws. We do need to set up a cybersecurity system in place that can be compliant to this latest evolving guidelines, because they are continuously in evolution. We need to invest in audit softwares. We need to invest in all these tools that are going to help maintain security. But if you talk about accessibility to these digital solutions, I feel that these laws can guarantee access, but it's extremely important to also ensure that these tools use the vulnerable population of our society, because that will really, these solutions have been developed to plug health service delivery gaps, and health service delivery gaps exist for the vulnerable populations more than for any other population. And if we do that, then only we can generate this to social impact. The legal environmental aspects are many. I'm not a legal expert, but I think that the things that are really relevant for us, and as it relates to health and diagnostics, we should focus on, we know that genetic testing, there was a company called 23andMe, and it ran into problems because it sold the data. So we need to make sure that we need to be very careful about third-party agreements. Theragnostics or Theranos, that was a company that also went down under. And these companies, the thing with third-party companies is always this whole abuse of data and the use of data. And so for-profit companies, we need to be careful about them. We have to make sure that data is being used for the right cause. And as far as diagnostics are concerned, for point-of-care diagnostics, they use a lot of plastic. I think that it's important for them to switch towards green solutions, green products, phase out all these single-use plastics. It's going to cost a lot of money to invest in green solutions, but once we make that, that leap of faith and invest in them, I think we can probably talk about more of sustainability. So I think I've come to the end of this talk. The conclusion for Diagnostics 4.0, technologies have evolved. They are becoming more digitized. They're becoming more connected. The context of use have evolved. In HIV, the context of use has shifted from treatment to more of prevention. And as we witness this sort of change and evolution, we see that the boundaries of use and the boundaries of context, all of that is becoming very blurry. Now that Cedric is nodding his head, he agrees with me. So, and as these solutions come into play, they are going to enhance, accuracy, but then we have to be careful at the cost of what? You enhance accuracy, are you going to be making sure that the solutions and the test results are going to reach the patient, and the patient, the test result gets acted upon and we link the patient to care. That to me is more important than getting a smarter test result at the point of care. We are going to be more than equipped to monitor outbreaks, surveillance, hotspots, geomapping, everything is out there. But early identification and action and making sure that the policies are in place for action, that is extremely important too. So their rapid integration and adoption will actually determine their success. So Diagnostics 4.0 in 2025 is here to stay. The deployment is going to be the biggest challenge. If it happens with the right governance structures, frameworks, policy, guidance, all of that, I think it can enable a new digital health transformation. I like this quote, and that reality is the new reality, or will be the new reality. George Westerman at MIT said, when digital transformation is done right, it is like the caterpillar turning into a butterfly. But when it is done wrong, all you have is a really fast caterpillar. So sometimes if you don't do it right, we are not going to be able to really get all the benefits of it. So I have a call. I think to enable all of this transformation, we really need to invest in training healthcare professionals. Because at all levels of healthcare, we need to invest in training digital health, in digital diagnostics, in these machine learning solutions, point of care solutions. We need continuous training because this continuous training will allow healthcare professionals to know where to use what in the context of this evolution. It will allow rapid and intelligent task shifting. It will increase efficiency in workflows. It will lead to optimization of tasks, and it will really help transform to a new healthcare reality. I would love to imagine. I love being a visionary, so I love imagining. And I think that this tricorder is actually going to be a reality by 2030. And hopefully by 2035, even at the MUHC, we will have something like these teleportation stations. And the day is not far away when tricorders and data powered by quantum computing, we will be able to work in multiple metaverses and teleporting stations. And the question is, are we all ready to teleport into space? Thank you.
Wonderful. Thanks for this fantastic overview on a very complicated topic. Very inspiring. Thank you. Final words, it is not impossible. A great big thank you to Dr. Nitika Pai for this inspiring lecture that clearly generated a lot of conversation, a lot of dialogue and interest. And congratulations on all the work you've done advancing this field. And we hope to see you back next year. Maybe we'll be talking more about the transporter. We'll be that much closer. Thanks everyone for your participation. I wish everyone a great afternoon. Bye-bye.